हेलो हेलो।
अस्सलाम वालेकुम सर।
अस्सलाम वालेकुम।
वालेकुम अस्सलाम। क्या हाल है सर जी? ठीक है?
अरे भाई, आवाज आ रही है?
जी सर, आ रही है, आपकी आवाज़ आ रही है, बिल्कुल आ रही है सर जी।
अच्छा, तो जो लोग पार्टिसिपेंट है वो एडेड है ऑलरेडी?
सर वो ऐड हो रहे हैं आहिस्ता आहिस्ता। 4 बजे का टाइम दिया है ना? ठीक है, तो चार
अच्छा
चार से लेकर 4:10 तक वो ऐड होंगे। फिर हम जो है वो इंट्रोडक्शन कराएंगे एनसीपीपी का और आपका, साथ में एक
अच्छा।
और फिर जो है इंशाल्लाह सेशन स्टार्ट करेंगे। ठीक है सर, मैं आपके साथ शेड्यूल शेयर करता
नो वरीज, ओके, नो प्रॉब्लम।
हूँ।
ओके जी, ओके, नो प्रॉब्लम। आवाज सही है, बिल्कुल क्लियर है।
जी सर, बिल्कुल क्लियर है।
और मेरा जो कैमरा है वो सही है, लाइटिंग और सब कुछ?
जी सर, बिल्कुल ठीक है सर।
अच्छा, तो इसी के साथ मैं मतलब वो ऐड कर सकता हूँ ना? मेरा स्क्रीन जो है वो मुझे विजिबल नहीं है यहाँ पे।
1 मिनट सर।
मुझे मेरा मतलब शेयर स्क्रीन का ऑप्शन आना चाहिए, राइट?
जी सर, मैंने अभी आपको होस्ट बना दिया सर।
वो सही है, लेकिन स्क्रीन शेयर ऑप्शन आएगा अभी मुझे?
सर ये नीचे देखें, शेयर स्क्रीन होगा यहाँ पर।
हाँ, अभी आ गया। हाँ, ठीक है। तो इसको मैं क्लिक करके फिर जो मेरे पावर पॉइंट्स है मैं ओपन कर सकता हूँ, तो आप लोगों को सारे पावर पॉइंट्स विजिबल होंगे, सही है?
सर पावर पॉइंट
ऐसा
की
है ना?
एप्लीकेशन, जो पावर पॉइंट आपने बनाई है ना सर, वो ओपन करें। पहले उसको ओपन कर लें लैपटॉप में ना। फिर जब आप स्क्रीन शेयर करेंगे
हम्म,
तो यहाँ से डायरेक्टली ऑप्शन आ जाएगा, आप उस पर क्लिक करेंगे तो वो हमारे साथ शेयर हो जाएगी।
अच्छा, मैं देखता हूँ सर।
Assalamu alaikum to all the new joins. We will start in a few minutes, inshallah. We will wait till 4:10 for all the participants to join. We will wait for 3 more minutes, and then we will properly start our webinar, inshallah. Bismillahirrahmanirrahim. I welcome you all to a webinar on career counseling and pharmacy licensing exams. First of all, we will start the webinar with the name of Allah, and there will be a recitation, inshallah. So after that, our webinar will be started properly. أعوذ بالله من الشيطان الرجيم. بسم الله الرحمن الرحيم. إنا أنزلناه في ليلة القدر وما أدراك ما ليلة القدر ليلة القدر خير من 1000 شهر تنزل الملائكة والروح فيها بإذن ربهم من كل أمر سلام هي حتى مطلع الفجر صدق الله العظيم. So let me start our webinar with the introduction of NCPP, the organization under whose flag this webinar is being held. So basically, NCPP is a volunteer pharmacist organization, purely non-profitable and non-organizational body, working to uplift community pharmacy in Pakistan. Doing health camps, internship programs, public awareness campaigns since 2015, and now ambassador programs, which is another step toward the betterment of community pharmacy. Through these ambassador programs, we actually wanted to make a bridge between pharmacy students and the pharmacy field. These ambassadors are going to represent the mission of NCPP in their respective institutes located all over Pakistan. Other goals of NCPP includes promotion of culture of utilizing proper pharmacy services, encouraging youth to preserve pharmacy profession, to create awareness among general public, and unite pharmacists on a single platform. So this is basically the NCPP and its mission, generally described in a few words. Now let me introduce our and welcome our prestigious host, Dr. Zia Ullah Samdani. Dr. Zia Ullah Samdani is a hospital pharmacist UAE and a PharmD RPH, having licenses of Abu Dhabi, DHA Dubai, QCHP Qatar, SLE KSA, Kingdom of Saudi Arabia, and MOH Sharjah. He is also certified in antimicrobial stewardship and certified in pharmacovigilance. He has a 13-year experience of Gulf as hospital pharmacist, pharmacy manager, and inpatient pharmacist. I heartily welcome you, sir. And now we will start our webinar properly. I will make Sir Zia Ullah Samdani. I will make you a host, and kindly you take the platform and deliver the lecture on the topic career counseling and pharmacy licensing exams.
Hello, assalamu alaikum.
Wa alaikum assalam, sir.
Mr. Arifullah, can you switch on my camera? I think it is switched off from your side. Video. I'm getting one option that the camera is being switched off from you, the speaker
Sir, I
side.
will make you a host and then you can do it. You are not the host, sir.
Okay, so you can do the setting from there.
Sir, kindly there will be an option uh, uh, just beside the mic option. There will be an option start video. So you can.
Yeah, that is already been clicked, but I'm getting one option. No,
Sir,
I think it's not working now.
yes, sir. So kindly start the presentation and also with a little bit of your introduction and then start the webinar. Thank you, sir.
Bismillahirrahmanirrahim and Assalamu alaikum. My voice and camera is visible to you people, video.
Yes, sir. You are clearly visible and clearly audible, sir.
All right. So actually, I'm Zia Ullah Samdani. I'm a hospital pharmacist in UAE for last 13 years. I have many licenses across the UAE and even from other Gulf countries. I'm having license DHA from Dubai, DOH from Abu Dhabi, Ministry of Health Sharjah, QCHP from Qatar, and SLE from Saudi Arabia. These things already been explained to you people. So I hope we can start the lecture. So I would like to share my screen. So, okay, all of you can hear me properly, right?
Yes, sir. You are clearly audible, sir.
Okay. Thanks a lot for your kind introduction, Mr. Arifullah. And I'm honored that I have been chosen for as a career advisor for you people. All credit goes to the organizing team, particularly to Mr. Arifullah. So let me start from the beginning. So there are some things to be clarified in the beginning. So actually the pharmacy licensing exam criteria for Gulf countries all over the world, it keeps on changing. So I hope the things what I'm going to share is updated till date, but most probably it can be changed after a month or after 2 months or these things. So keep in mind that always check the concerned website for the licensing exam criteria, document evaluations, and everything. So I'll go to the first slide. So you people as a pharmacy students, you should maybe you have this idea of these exams like NAPLEX for USA, PEBC for Canada, EPIC for Australia, DOH for Dubai Health Authority, Abu Dhabi, sorry, DHA for Dubai Health Authority, MOH Ministry of Health UAE, Oman, and Qatar, and SLE. So these are licensing exams. So I'll focus on the examination criteria for Gulf countries because I have experience in Gulf countries. So I am aware of all the licensing exam criteria, procedures, documents. So I'll not focus on the NAPLEX, PBC, EPIC, and these exams, but I will just share few slides for you people for your reference. So hope those slides will help you a lot. So always remember that all licensing exam, which I told you in the beginning, that all licensing exam criteria keeps on changing. So always check their websites, requirement, procedure, documents, which kind of documents are needed, fee structure, what is the fee for the examination, passing scores, frequency, like how frequent the exams are conducted all over the world. Always keep these things in mind. And one more thing I want to add here. The thing actually, you will see many platforms on social media where they are providing information and questions and references, but you should check those things, but don't rely on those things because these things are changing with time. So always check their specific websites for for the particular exam which you want to appear and things. So next is I have mentioned fee structure for few licensing examinations, but that could not be different from the actual and latest fee structures. What I'm going to share that is just because I got some information as per the latest examination criteria, but these things are changing. We don't know when the structure will be changed, what would be the PSV fee, what would be the document evaluation fee. So these things keeps on changing. I emphasize licensing examination requirement and procedure for Gulf countries, particularly UAE. So our next slide is process flow. What are the things, how you will, let's suppose if you completed your degree Form D, or some university they have to be Form. So first thing, if you from like 4th year or 5th year, you should have an idea that what I'm going to do. Like you should have a plan that I want to go to Canada, I want to go to US, UK, Australia, Gulf countries, Saudi, anywhere. So keep in mind and follow the the exam criteria from the degree, the day once you get the degree. So first thing is you should have the documents. Which kind of documents are needed, I'll explain in my next slide. Then verification and attestation. This is the next step. Once you have the degree, the experience certificate, transcript. So what is the next step is verification. Verification means from your university, then from authority, from Ministry of Foreign Affairs, immigration. So this is the next step. So I'll explain in my slides each and every step next in slides. What is the examination? Examinations criteria is different for all licensing exam, for all states, for all countries. So I'll explain briefly all the examination criteria procedure. Okay, once you appear in the examination, next step is document evaluation. Document evaluation and document verification is different. Evaluation means that your documents are evaluated through a third party. That third party is known as data flow team. So this team, there are two types of evaluation. One type of evaluation is done before the exams, like Gulf countries exam, particularly for Abu Dhabi. That data flow part is done before the examinations. Once you want to appear in the exam, that data flow will confirm your documents from the primary source, from the university, from the experience organization. So these things, it will be updated in the HAAD website, Health Authority Abu Dhabi website, and then they will approve for the examination. But some states, they will do this part after the examination. Once you appear in the exam and you got the passing marks and you got the job, so and if you want to come to the Gulf countries, then they will do that part, the data flow part. So it is different for a different examination exam. Then once you do data flow and you get the job, so next step is you get the job, you come to UAE, Gulf countries, and then traveling charges. But remember, visa procedures, this is different part from the exam. Examination has different procedure, criteria, documents needed, and everything. And visa has different procedure and different type of documents they are needed. So this is different from the examination. Then license activation by your sponsorship. Once you reach here, you got the job offer and you join the company, they will activate your license from the health authority. Whatever health authority is from Abu Dhabi, Dubai, or Sharjah, they will activate your license. So some license that is issued on your name, and some license that is issued on the company name. So I will go to the next slide, which is documents. Which kind of documents are needed for the licensing examination, particularly for Gulf countries? So the first thing is your degree. Once you have the degree, you keep it with you, and then a transcript, and then experience certificate. Experience certificate is like a 2-year experience after your graduation. The day once you are graduated and the date mentioned on your degree, they will consider 2 years after your degree issuance. Like it is issued in December 2016, so they will consider December 2018 as a 2-year experience. And remember, this experience should be in a hospital or in a community pharmacy, not like a marketing job, industry job, or some regulatory job or something else. They only consider experience in a hospital and in community setup. So then next document which is needed is your registration. It's all of you. Once you get the degree, so then you have a next step to register yourself with Pharmacy Council. So you should have that document also to apply for the examination. Keep it ready, these documents, which I'm telling you, like 5, 6, 7 documents, which is very important for you people to keep, prepare, attested, and these things. Next is good standing certificate. Consider only PharmD degree, but if you have graduated before 2003, you can show, yeah, like you can use your BPharm degree as well. Sorry, 1 second. Then your country license, like country license, as I told you, as a pharmacy registration. Then TOEFL, the score is there, like some scoring. Then you will they will approve your examination. Then if EGEC exam, sometimes it is GEC and sometimes it is GEE. They will conduct the examination. Then if it is passed, then you will go to an NABP website, and then they will approve the examination for the NAPLEX. Once I told you before this slide that you should have this FPGE exam. Once you pass, you should have training for some credit hours. Then after that, if you are eligible, they can allow you for the NAPLEX examination. I'm talking about US.
Sir, excuse me, sir.
Yes, please. Yes, please.
Sir, kindly can you share the screen, sir? It's not visible.
Now it's visible?
No, sir.
Before it was visible, right? Before it was visible?
No, sir, it wasn't visible. Sir, it's...
you didn't see any slide at all?
No, sir. We haven't seen a single slide up till now, sir.
Allah. Now you can see?
Yes, sir.
Oh, so I have to repeat the things, or you want me to go to the current slide?
Sir, just read the point.
Okay, I'll do it just in a short way. Yes. So this is the first slide which I'm going to share is international pharmacy exams, what are the exams which I told you in the beginning. That is NAPLEX for America, PEBC for Canada, EPIC for Australia, DOH for Abu Dhabi, DHA for Dubai, MOH for Ministry of Health UAE, Oman exam, Qatar exam, and SLE for Saudi. These are the exams which are conducted all over the world. There are many exams, Denmark and Sweden and this thing, but these are the examination which are to be considered for a pharmacist who wants to pursue their career outside the country. So these are the examination. This I told you this slide that all examination criteria, procedure, everything keeps on changing. So keep in mind that always check their websites for the latest update for the examination. This I already told you. So process flow. This is the most important thing which you should keep in mind. Process flow. So the first thing is your documents, like how you will appear in the exam. What are the things to be done in stepwise? So first thing is your documents. You should have your documents, which I'm going to share. Which kind of documents you should have in the for the examination. Verification. Which documents what are the organization through which your documents should be verified. Then examination. Once it is verified, then you will appear in the examination, which is mostly online for Gulf countries. Then documents evaluation. Documents evaluation, sometimes they are doing before the examination, and sometimes some states they are doing before examination, some states they are doing after the examination. So this is the part, this documents evaluation is done by a third party, which is data upload team. So this is a third party. You will upload your documents and you will pay the fee, and they will evaluate your documents within 3, 4 weeks, 5 weeks. So then they will approve your documents. They will send you an email, and they will send an email to the the authority where you want to appear in the exam. So the authority will send you an email like, okay, that your documents are evaluated, you can appear in the exam. And sometimes it is done after the examination. Once you appear in the examination, you pass the examination, and you have the passing marks. So then they will do it after the examination. Then after documents evaluation, you should have a job offer or visa or traveling for the Gulf countries. Once you get the job offer, or you can come on visit visa. So that is another part of the to come to the UAE or Gulf countries. Documents evaluation is different and visa process is different. So you need different kind of documents for both. Then once you reach here and you have a job, then you can start a job with the sponsorship, the sponsor, and they will activate your license. So this license is sometimes it is issued on your name, and sometimes it is issued on like a company name. So this license, once you appear in the exam and you pass the exam, it has validity. Like sometimes it is 8 months, 2 years, 3 years, 6 months, 8 months. It varies from authority to authority. So within that time, you have to activate their license. So Arifullah, you can see all the slides right now, right?
Yes, they are visible, sir.
Okay. So as I told you, the documents, so what are the documents which is needed for your licensing examination? The most important thing is your degree, your transcript, experience certificate, registration with Pharmacy Council, and some like a good standing certificate. This good standing certificate is issued by your Pharmacy Council. This documents is needed for some state exam, not for all. Some are asking for this exam, some state they don't ask for this, for this certificate. So this is the basic documents which you should have before you want to appear in the examination. Next is visa. For the visa, most of you people will know that what are the documents needed for visa. This is your passport picture and police clearance certificate. And I repeat here that some extra documents are needed for UK, US, Canada, and Australia. So always keep in mind this is not the standard for all countries. This is just I'm always emphasizing Gulf countries. So keep in mind that these documents are needed for Gulf countries. Okay, documents attestation. Once you have your documents, like most probably once you are graduated, you should have a degree, transcript, and after 2 years you should have a experience certificate. And same time you can register with Pharmacy Council. You should have at least 4 or 5 documents in hand to start this process. Your degree attestation is needed from university, the university from where you are graduated, HEC, Health Authority, Higher Education Commission, Ministry of Foreign Affairs, Ministry of Health Islamabad, UAE Embassy Islamabad. If you want to come to UAE Embassy, other countries, so you should go to that embassy to verify your documents. This Ministry of Health Islamabad attestation, it is needed for some states. Sometime it is needed, sometime it is not needed. So to be on safe side, you should have this document attestation from the this authority. Your experience certificate is you should get signature and stamp from your drug inspector, district health authority, district health officer. Sorry, Pharmacy Council, Ministry of Foreign Affairs, Ministry of Health Islamabad, the same one, and UAE Embassy. Remember, once you want to get an experience certificate should be issued by the hospital and community pharmacy. Other things like marketing, regulatory jobs, and teaching, they don't consider this type of experience. They consider only hospital experience and community pharmacy experience. Always keep in mind that experience certificate, if you want to have it, or it is to be issued by the organization, it should have the starting date, ending date, job descriptions, company name, and company contact number. Everything should be there. So because the third party will contact this organization through the data flow process. So keep in mind this document should be authentic. Otherwise, if you do all the process and you send for the data flow, so they can reject, or you have to do all this process from the beginning. So keep in mind your experience letter should be authentic to have all these things, what I said. So I'll start from a US exam. So I will highlight these exams only. I'm not going in details. I'm just sharing a few slides for these examinations that you should have an idea what kind of exams are there all over the world. So first thing is NAPLEX and FPGE, FPGE or FPGEC. So the most important thing is your TOEFL score, your foreign pharmacy graduation evaluation exam. You will after TOEFL you have to go to US. I'm telling these things that US, Canada, Australia, UK. You have to be there for this examination. These are not online examination that you can appear from your home country and you can attempt the exam from your home country. These exams are conducted in US and all their respective countries. So you should be there for these examinations. So before that one, you have to go through the visa process and do all the things, the documents and everything. So once you have all those documents, you can apply for visa. Once you are there, you can go through all these exams and these steps. So keep in mind, US, Canada, Australia, and UK and other European countries, their exams are always conducted in their home country. While UAE exam, prometric examination, Saudi, Oman, Qatar, these examinations are conducted online. So you can apply from home country, and once your documents are approved, you can go to the examination center in Islamabad, and you can appear from there itself. Okay, so after FPGE exam, you should have training. Training it is like some credit hours, 800, or some hours are 8 months, 9 months experience, like training. You should have like intern job. So after that, you will apply for NAPLEX exam, North American Pharmacist Licensing Examination. And next is jurisprudence exams, which is like a law type of exams regarding regulatory issues. So these are the steps for applying for this FPGE exam and NAPLEX exam. First, you should have a degree, which is 4 years. If you are graduated before 2003, that is 4 years. After 2003, they consider only 5 years degree, like Form D. And then you should have your country license, like registration and TOEFL score. Then you will appear in the examination. If you pass the examination, then you should have training and these things. Then you will apply for NABP. This is a website, and they conduct the NAPLEX examination. Then you will appear in the NAPLEX exam. Once you have the NAPLEX examination clear, you can work in some states like California or Los Angeles, anywhere you can work. But some states, they conduct extra examination, like separate exam without NAPLEX. You will have NAPLEX and you should have that license. So it is a long process in this country. What are the course content of the examination? I'm always focusing on the things. You always study the pharmacy course from A to Z, not like any examination, even in Gulf countries, anywhere. They don't they don't tell you about a specific reference book. So you should go all through all the books. Like this is the syllabus for the NAPLEX and syllabus, this one PGE examination. Pharmaceutical sciences, medicinal chemistry, pharmacology, toxicology, pharmacognosy, and all these subjects you have studied in the pharmacy. So you should have studied all these books if you wish to appear in the examination, particularly for US. And there are clinical sciences is like trials, research, drug information, pathophysiology, clinical prevention and population mitigation. These are the topics which are added. It is available on their websites. So you should have these subjects and this expertise in the medicine, pharmacy. So what is the exam format for this FPGE? This is 250 MCQs, 330 minutes. Most probably it is conducted in April and September. Fee is, it varies from time to time, and maybe from country to country. So most probably it is 90 and then 800 dirhams for the examination. First, if you want to open an account and apply, that is $90 and then 800 US dollar. It is conducted in US. This is, I'm talking about first part of FPGE exam. For NAPLEX, the questions are different. It is 185 MCQs. It is computer-based and scenario-based. Scenario-based means you will demonstrate and they can ask you any question like that. It is conducted twice per year and the fee is $485 and it is conducted in US. Examination format for NAPLEX, the passing score is 75. You should have 75% passing marks, and then internship, and then maximum attempt 8 attempts for NAPLEX exam. I'm not going in detail for FPGE. I just told you about FPGE exam. And now for Canada, you can go through this website if you want to appear for the examination. First step is documents evaluation, then evaluation for examination. And then first they will check your documents, and then they will evaluate for the exam that whether you have done the proper internship and these things. So this is part of evaluation exam. And then first exam and then second exam, the fee is like 530 Canadian dollar. And the format is 180 MCQs, 180 minutes, exam date January and July, and the fee. I'm telling again and again that these things are not fixed. What I'm telling is as per my knowledge and whatever I know, and I know from my colleagues and whoever. So this is as per their knowledge. So the things may be changed, the fee structure may be changed, the format may be changed, the number of questions may be changed, the exam format may be changed, everything can be changed, but this is just an idea that you should have in your mind. This is PABC examination, 400 questions and 2 consecutive days, fee 400 Canadian. Examination 2 is oral structure exam, fee is 15-20 Canadian dollar. It is conducted in Canada. So these are the steps: first exam, second exam, and some jurisprudence examinations and student internship. And then once you do all these steps, you will be as a registered pharmacist. You can work in different states of Canada. This is Australia pharmacy exam. So apply for APC eligibility assessment. You will do it online. Then if application is assessed, then they will do eligibility. They will issue an eligibility letter. Then you can sit in the exam. But keep in mind that you should be there in a stage. It is not an online exam. Since skill assessment letter is issued, and then you can apply for the BA or BAPP examination. These are the examination for Australia. Documents needed. This I shared in the beginning, that these are the documents needed for all examination. These are compulsory documents needed for all exam, but some extra documents are needed, which is available on their website. It is like personal identification, passport pictures, academic qualification, degree, and your transcript, evidence of registration, like your country registration, work experience, and these things. So this, I'm not going in detail for Australia also. I already told you about the things. So this is eligibility assessment. The initial step is documents eligibility assessment. You have to pay the amount, IELTS score, CAPS examination, paper 1, paper 2, and then practice under supervision. You should work internship. It is mandatory for almost all European and Australia and US, that you should have proper internship. Like after first part, you should have some experience, internship, sorry, 8 months, 9 months, it depends on the country. So you should have these things. What are the requirements for the examination? Completion of practice experience, your experience at least 50%. And passing CAPS part 1 exam, and then language test. Language test, I told you, these are the tests which are there for these countries. This is examination syllabus. Oral examinations, completion of 75% experience, examination syllabus, medication knowledge, primary healthcare, legal and ethics practice, communication. These are the most important things which you have to study before you want to appear in the exam. Exam format is 25 minutes. You will be examined by an examiner. It is conducted in February and June. The fee is 370 Australian dollar. This slide I already explained in my first few slides. Okay, now I'm coming to UAE examinations. So this is actually my main focus, that I would like to highlight the licensing criteria for Gulf countries, particularly for UAE. So UAE, there are 7 states and 3 kind of licenses. Some licenses can be used in many, like more than 1 state, and some are used in 1 or 2 states. Like Abu Dhabi, you should have DOH license, Department of Health. Same license can be used in Al Ain, Dubai, you should have DHA license. Sharjah, you should have MOH. Ajman, MOH. Rasul Khaimah, MOH, and Al Quwain, MOH. Then you should have should know about Saudi licensing exam that is conducted through Prometric. Prometric is an online system. You can apply through Prometric. They will arrange your examination, particularly in Islamabad. So you can appear from a home country. For Oman, there is Prometric exam. For Qatar, there is QCHP exam. So registration for these are the names of the examination. So what is the registration process for Ministry of Health? MOH exam, you should go through that website, www.moh.gov.e. Then e-service, click on e-services, create an account and upload the relevant documents, pay the initial fee, which is 257 AED. Wait for their approval. Once your documents are approved, they will send you an email for data upload. Then you will do data upload and everything. Then email will be sent to decide your examination. So these are the steps. You create an account, wait for the response, second mail for data upload team. So once your documents are evaluated through data upload team, then they will approve your examination seat. So you can decide the date and center. It is as per recent update. This exam is 70 questions, computer-based question, and 60% passing marks should be there. You have to finish the exam in 2 hours. And this is DOH and DHA requirement. This is main criteria for the lesson. For clinical pharmacy, you should have PharmD degree, which is 6 years. That is clinical. But clinical pharmacist is different than pharmacist. Clinical pharmacist has different criteria. So clinical pharmacist, you should have PharmD degree, okay, and plus 2 years post qualification experience. And for the pharmacist, normal pharmacist, you should have BPharm degree, that is pharmacy, and R PharmD, and BPharm or PharmD. Remember, whatever the course we have in our country is PharmD, which is 5 years, but in Gulf countries, particularly in UAE, they consider PharmD as a 6 years course, not a 5 years. Whenever you want to apply for a clinical pharmacist, I'm not talking about other exam, because for other exam, BPharm, B Pharmacy, and PharmD is same, so they consider as same degree. But if you want to appear for the clinical pharmacist exam, you should have PharmD degree, which is a 6-year degree, and which our country people, they don't have this 6-year degree, because our country they have 5 years. So this is our thing that they change the criteria, or we start 6-year course, so then it is possible. Then DHA Dubai exam. Then this is the website. This is the the website. You go through the same process, almost the same price process, but different in the question numbers, format, and things. But mostly the criteria is same. Your documents will be evaluated through data flow, and then they will send you an email, confirmation email, that you can appear from the home country. So most of the criteria for all these 3 licensing exam for UAE is the same, but go through their specific website, not through one website. All of them, they have the separate websites, so you can get all these information, updated information. This is the information, but updated information. Everything they keeps on changing, so you will get latest information regarding exam. This is for the Prometric examination is for Saudi and Oman. They have the same criteria: documents evaluation, creating an account. Then they will do data upload. They will send you an email for confirmation. Then you can sit in the exam, and once you score 70% marks, then you can have a job and you can come to the country. So the same thing for Qatar exam also. So this is all about licensing exam in Gulf countries. So I hope these things have clear to you people. So I will go to something extra. you should keep in mind while countries. You should have knowledge of English and Arabic, Gulf license. In Arab countries, they have multinationality like Indians, European, American, Philippines, and so you should have like it is a multinationality country. So you should have a bit knowledge and of this language. Opportunity for a pharmacist in Gulf countries. What are the opportunities once you pass the exam, and if you want to come to these countries, what are the things which sectors you can work? That is retail or community pharmacy, hospital pharmacist. Hospital pharmacist, you can work as an outpatient, inpatient, clinical pharmacist. You can work as in industries. Industry pharmacists, they don't need your license. You can come. They can consider you without license, like DHA, MOH. So you can work without license. Same for marketing, regulatory job. Sometimes they ask, but most of the time they don't need this country license. Teaching faculty, you can have training job like with less salary and less salary expectation. Scientific writing, toxicologist, and these are the jobs which you can get in Gulf countries, and you can keep in. What is the job description of pharmacists in Gulf countries? What we have in our country? First of all, I'm sorry to say that in our country there is no concept of a pharmacist, particularly for a community pharmacy and hospital. We don't have structure. We don't have facilities. We don't have policy, procedure, guideline, and these things. But in this country, Gulf countries, we have job structures, restrictions, all these things. So what are the things what a pharmacist do in UAE or Gulf countries? They dispense prescribed medications, counseling, dispensing OTC medication, cosmetics, consumables, and medical equipment. They do inventory, ordering, dispense control, semi-control, and narcotic medication as per the country law. Contact physician for many drug-related issue. If there is any issue related to prescribed medication, the pharmacist can call the doctor, and he should answer the phone, and he should explain if there is any discrepancy in prescription. So these things are not there in our country. This is, So the doctor, whatever the doctor is prescribing, the prescription itself, it has doctors or the hospital contact number, so you can reach the doctor, and the prescription is legible. Like it is always computer-based prescription, or if it is not computer-based, it is legible handwriting, so you can read properly, and you can change once you call the doctor. You can change prescription if there is any issue. You can call the doctor, and if he says okay, change, go ahead. Whatever you want to change, like there is dose error, or there is drug error, or there is drug interaction, or there is any issue like drug allergy, and patient has own medication in home, and he didn't tell the doctor, and he told you. So you can call for any issue, and they can the doctor will happily answer the phone, and they can tell you to change the prescription. Not to change the prescription, writing or anything, but you can write a remarks once which kind of remarks doctor told you, so you can do it accordingly. Take approval for insurance. Most of the population in UAE and Gulf countries, they are insured people, so you can take approval as per insurance protocol. That is online procedure. They take some 5 to 10 minutes for approval. You enter all patient details and medicine quantity, duration, everything, and they will approve in 5 to 10 minutes. This is common. Keep confidentiality of the patient. This is most important thing, that always keep patients confidentiality. That don't discuss patients disease, drug, or anything to other people. So this is most important thing to keep in mind. Job description of pharmacist. This was what this was about. The community pharmacist. So what is job description of inpatient pharmacist? Inpatient pharmacist job is a bit different than outpatient pharmacist. Inpatient pharmacist means those who handle patients who are admitted in the hospital. That may be critical care, ICU, admitted patients, oncology patients, rehabilitation patients, operation theater. You can provide the medication. So the job description of inpatient pharmacist is a bit different than outpatient pharmacist. What inpatient pharmacists do is prepare order for admitted patients who are admitted in the hospital. So they are preparing medication, compounding they do compounding whenever it is necessary, like to mix sterile and sterile compounding, like to mix some creams and these things they can do. IV mixing, that is common in many setup. A dilution of concentrated electrolytes, some electrolyte which comes in concentrated form. Sorry, concentrated form. So you should dilute according to the doctor's order. Reporting, if there is any issue, you can report as a pharmacovigilance or controlled semi-controlled drug loss. If there is any issue, like the quantity is not matching to the system, or in inventory you found any issue, or anything happened related to medication, you should report. This is a good thing in many organizations, very like those hospitals who are accredited by JCI. So those hospitals, they practice these things like reporting drug error, adverse drug reactions, and they have quality teams, so they monitor these things, and they are trying to minimize these error. If it is serious issues, they can do proper action against the issue. Contact physician for any issue related to orders if doctor prescribing. So same thing like outpatient. Maintain patient medication record. It is common that pharmacist who is working is an inpatient pharmacist, he keeps all medication record. So whenever there is any issue related drug interaction, dose error or anything, he can inform the doctor, or even he can check with the nurses if there is any issue. Prepare unit dose. Some hospitals they practice unit dose. Unit dose means you prepare medication for 24 hours or 2 days. It is not like you give boxes to the admitted patient. You prepare once in 24 hours who are admitted in the hospital. Maintain ward stocks. You are providing medication to the ward like critical care, or operation theater, or rehabilitation. You keep proper record that which medication you have issued to these units. Maintain crash cart stock after each use. Crash cart is actually in a trolley which is used in code blue. Like whenever there is cardiac arrest in a hospital, so this trolley is ready-made trolley which is used for cardiac arrest. Like whenever there is cardiac arrest, the nurse will go to the crash trolley. He or she will open the trolley and he can use the medication, which is life-saving drugs. So pharmacist, most of the time, he's taking care of this crash cart trolley. He used to check the expiry, missing drug. So he's supposed to provide all the needed medication to the crash cart. Arrange the medicine which is not available in formulary. All hospitals in UAE, most of the hospitals, they follow formulary, which is managed by pharmacy and therapeutic committee. Pharmacy and therapeutic committee, it is actually the group of people who have like person from management, physician, pharmacist, and nurses. These people, they arrange annual meeting or meeting every 4, 5 months, 6 months. It depends on hospital policy. So they discuss hospital medication, which is needed, which is not needed, which medicine are to be added in the hospital medication list, which medicine are not used many years, so we can remove to reduce hospital expenses. So this medicine, crash cart medication, it should be available in formulary, and when it is not available in formulary, they should revise the formulary, or they should arrange the medicine for the emergency use for the crash cart. Comparison of pharmacy practice in UAE and Pakistan. So this is just an idea for you people. So you should keep it in mind, and that what are the things which is done in UAE and Gulf countries, and which is not in our country. So there is most of the time the prescription is generic prescription. Here it is all ministry, they encouraging the generic prescription, like generic name of the molecule. Like and they encourage computer-based prescription. Pharmacists can dispense pharmacists cannot dispense antibiotic without prescriptions. So it is very good things in these countries that you cannot dispense antibiotic. Antibiotics is some antibiotics are life-saving antibiotics. You should not use inappropriately, because it causes resistance and it causes patient harm, super infection. So whenever the patient comes to the pharmacy and he asks for antibiotic, you should ask for the prescription from the doctor. this prescription should be valid, like not it is written 1 year before or 2 years before, or it is written on somebody else. And so it should always be authentic for the same patient and within 4 or 5 days. So these things are to be considered in for dispensing antibiotic. In some states, particularly in, for example, Abu Dhabi, pharmacists even cannot dispense medication except OTC. Some states they encourage to dispense medication what is prescribed, like the patient comes and they ask for some antihypertensive medications or cholesterol medication or chronic medication, and you give the medication, which is very common even in our country. But particularly in Abu Dhabi state, they encourage the patient should have a prescription, not like to give without prescription. There is proper reporting and inventory system of control medication, semi-control medication, and narcotic medication. Control medication in our country, there you can find in any pharmacy. Like you go to pharmacy, you ask for Tramal. Nowadays, I'm not telling that this is not common. I'm telling that these things, up to some extent, these things are improved in our country. It is highly appreciable. Like some drug inspector and they are checking these things. This is very good sign. But still, as you go to the pharmacy, you can ask for Tramal, Xanax, Valium, muscle relaxant. So you can get without prescription in our country. But you cannot expect these things in Gulf country. You should have a proper prescription, valid, authentic, signed, stamp. All these things should be there if you are dispensing this medication. I use 3 terms: control, semi-control, and narcotics. Control medication, like you can say, like anxiolytic drugs. Semi-controls, mostly they classify as an antidepressant. Narcotics, you people know morphine, pethidine. It is used for analgesia. Pharmacist is free to contact prescriber for any medication related issue. This is what I told you. Pharmacist can call the doctor for any issue, which is not common now. All prescriptions are provided with contact details. I told you in the beginning. Medication are stored as per product and company requirements. Light sensitive medications, humidity sensitive medication, temperature sensitive medication. It is stored as per its requirement. But unfortunately, in our country, it is not like that. You can mix like these things. Some light sensitive, humidity sensitive medication. It is all kept in same shelves, and these things, no separate system, no pharmacy, system to control temperature, humidity, pest, dust, these things. Patient should have no access to medication except OTC. Whenever a patient comes to your pharmacy, the patient is not allowed to go and take medication and check and ask for the price and go. It is not like this. The patient can access to OTC medication like Panadol, Brufen, or some OTC topical product. The patient can take these things and the patient can take this medication by itself and they can ask the price. But prescription medication, control, semi-control, vaccine, fridge items, all these things are under under pharmacist supervision, and only pharmacists can issue this type of medication. Pharmacy temperature, humidity, light, hygiene, and pest control policies are strictly observed in these countries. Okay, pharmacy should operate. Pharmacy should operate under the supervision of registered pharmacists. This is the most important thing, and which we always encourage in our country. And we are, in many platforms we are insisting that pharmacy should be open under the supervision of pharmacists, and it should operate under the supervision of pharmacists. All other stuff should work under the pharmacist, but it is not like that in our country. Hopefully, these things will improve shortly. In some states, it is highly recommended to assign segregate area in pharmacy for. In UAE, it is not common, but it is always encouraging. They always encourage these things to have these areas, particularly the health authorities. They used to come for the inspection and they see the pharmacy, interior. You should have segregate area for expired medication, near expired medication, recalled medication, narcotics, control and semi-control medication, high alert medication, lookalike medication, fridge items, patient counseling area. These are the things which are very important for the pharmacy to operate. These are segregate area for all these things. Pharmacists should have working internet, fax, and phone connection. It is very common in in Gulf countries, particularly in UAE. You should have access to these things to take the approval, to call the doctor, to receive fax. So it should be there. While dispensing prescribed medication, the pharmacist should check patient name, age, insurer or not insured, medication and dosage, interaction, allergy, date of prescription, everything he can check. After that, he can proceed for the dispensing. So these things I already discussed, and I don't want to go to compare Pakistan and this. I hope that things are improving in our country, and most probably we will see many things, improved things in our country. So I don't want to compare because we are, poor country. I mean, we cannot afford many things. So this is pharmacy specification. What are the specifications of the pharmacy? Mostly I discussed in the previous slide. So presence of licensed pharmacists in working hours is the most important thing. Ministry comes and they've inspected your pharmacy, and the pharmacist is not available, so they can take strict actions against the owner, against the pharmacy. So pharmacists should be there in working hour, whatever the working hour is. If it is day and night, it is 24 hour, it is 6 hour, 8 hours, whatever the timing, the time the pharmacy open, the pharmacist should be there. Other staff should work under the pharmacist supervision. Prescribed medication area, OTC area, pharmacy should meet proper storage requirement of medication, which I told you in the beginning. Patient counseling area should be separate, and it should not be like public area, like the patient, 10 patients are waiting and you are trying to tell the patient like what is your condition and why you are taking this medication. So keep in mind the patient confidentiality. You should have an area that if the patient wants to discuss his or privacy or some disease or some drug issues or anything, so there should be an area that patient, the pharmacist can, explain to the patient, and nobody else can access that area. Patient counseling area is done. Control medication storage area, fridge, bulk storage area, expiry. This all are done in this previous slide. These things are already discussed. What is the pharmacist requirement? Degree and registration. Other responsibility, working hour, presence. This is what I told you. Supervising the staff. Responsible for all services of the pharmacy. All services what are conducted in pharmacy, it should be supervised by the pharmacist, not other staff. Quality, patient's confidentiality, patient rights, importance to deserve patients. Some patients will come and one is old patient and other are young patients, so you can keep priorities. These all things are there. That is importance to deserve patients, dispensing and counseling. Basic skills, what is needed for a pharmacist who work in a pharmacy. Drug law and regulation. The pharmacist should know the country law and regulation. What are the law and regulation? If you challenge, if you violate any law, there will be consequences for any violation. Communication skill, pharmacist should have communication skill to explain the medication to the pharmacist, to talk to the doctor, insurance people, and narcotic drug law. The pharmacist should know all these laws. Dispensing and storage skills. Pharmacovigilance means reporting. Calculation and dosing. The patient comes and the doctor call you, okay, you are working in an inpatient pharmacy, and the doctor call you, okay, I have a patient, he has kidney issues, this serum creatinine is high, and I want to give this medication. So he will ask your suggestion. So being a pharmacist, you should answer on phone immediately, or if you don't know, you take your time and call the doctors to the extent. But these things are expected from a pharmacist. The pharmacist who works particularly in an inpatient setting, they are expecting many things from a pharmacy, like dose calculation, drug-drug interaction, drug cross allergy, like some drug have cross allergy, penicillin. If the patient is having penicillin allergy and the doctor wants to give like other cephalosporin from the so up to some extent there is cross allergy concern. if the patient is allergic to augmentin and the doctor wants to give cefixime. So these things are always asked from the pharmacist. So he is the best person to answer and clarify the things. Pharmacokinetics, drug interaction, poisoning and management. What are the poisoning? What the pharmacist will suggest if there is any acute poisoning. Source of drug information to all doctor community and other healthcare. Pharmacist is considered as drug expert in UAE. All the people, nurses, doctor, all the people, even the concerned regulatory authority, they are expecting everything from the pharmacist related to the drug. Okay, so there's something extra skills which make your your curriculum high, and this thing demand high. So these are extra thing compounding. You should have idea about compounding, IV dilutions, IV mixing, dose calculation, and adjustment in kidney, liver issues, pregnancy, hypertension, diabetic, drug-drug interaction, drug-food interaction, drug-disease interaction, and drug-lab interaction, pharmacotherapy, use of medical equipment, particularly glucometer, nebulizer. These all things make you, your career up. So you can have all these extra skills. There are online certification for all these skills, and you can avail those certificates. So this is something related to doctor, pharmacist, and patient relationships. What is an ideal practice? What the doctor, pharmacist, and patient should work? How the cycle of the medicine flows in an ideal system. So I don't think so. You need this slide. So this was all about my lecture. So I hope you understand all the things what I explained to you people. And one thing which I want to share in my last slide. This is my book, which I have started, and it is almost done. I think 90%, 95% the work is done, but I'm still I'm too much busy, so I couldn't manage to review and to edit the thing. So hopefully this book will be available. This is not a book, not a reference book for any examination, but this is a common book which help for all licensing examinations. It covers the thing which are frequently asked examination. So hopefully once it is published, I will share on my social media, so you people can have it if you want. And you people can reach us on these social media platforms, on my WhatsApp, LinkedIn, and okay. Hopefully you have enjoyed the lecture. If you have any sort of question, you can ask, please. Thank you.
Thank you so much, sir, for such a detailed and enlightening session, sir. As it is said that it is more rewarding to spend an hour with an experienced and educated person than going through 100 books on your own.
Thank you so much.
Sajid, thank you so much for such a great session, sir. It was quite educating and quite enlightening for all of us. And I think most of the ambiguities and the questions regarding the foreign licensing exams have been cleared, because as sir have personal experience of 13 years and he's also certified in many countries and states. So it was a great session, sir, from you, and we have learned a lot from you. So all of you, sir, I will request all of the participants. So if anyone have any question regarding this session, or any question from regarding the foreign licensing exams or practicing pharmacy in foreign states, so I will unmute all. You can raise the hand and I'll unmute you, and you can ask this, sir, on your own.
Sir, I have a question, sir.
Yeah, please go ahead.
Sir, my name is Zishan Ahmed Khan, sir, and I'm a final year student at PharmD, sir. I have a question about attorney pharmacist. How can we apply as attorney pharmacist for UAE and KSA, sir? Please briefly explain, sir.
You are asking about trainee pharmacist, right?
Trainee pharmacist, sir. How can we apply for trainee pharmacist for UAE or KSA, sir?
Okay, as per the trainee pharmacist job and opportunities are concerned, actually nowadays the market is a bit saturated, and there is one more thing which is common in UAE. There is one diploma holder who particularly it is common in India. Pharmacy assistant. Pharmacy assistant is like a diploma course which are there in India and many other countries. So if there is any trainee job or anything, so most probably they hire that type of people, pharmacy assistant pharmacist. So those people are trainee, they are occupying those positions which should be available for the trainee pharmacists. So still there are many sectors they are hiring trainee pharmacists. So what is the best way to go for such job searching and these things? Uh, if you comes to UAE, then there are many big organizations. You can drop your CV if you have someone they can help you. Or there are online. If you can you register yourself. Many online portrait they can help you in searching a job. So once you get a job, you can come after getting the job. So for that type of job, there is no licensing criteria. You can complete your 2 years, which is needed for licensing exam. You can work as a trainee job for 2 years. So after that, once you have enough experience, like internship, you can apply for the exam. So this is the normal way. You can apply online. You can have some friends, seniors, so they can help you in this regard.
Thank you, sir.
Thank you so much.
Hello, assalamu alaikum, sir.
Wa alaikum salam.
My name is Khalid. I'm a student of 5th year, Concepts Tabad. Sir, when we have to apply for the exams, I mean, do they need any kind of experience?
Yeah, as I told you, once you have degree, you did Form D. Let's suppose you finish your Form D and yeah. So I suggest all the students, once you complete your go for the internship. But if you want to come to Gulf countries or abroad, so always focus which country you want to go. So follow those things. Particularly if you want to come to Gulf countries or UAE, so you should go for hospitals or community. Actually, we are unlucky. We don't have such structure for community pharmacists. And nowadays, the things are improving. I'm really happy with that things that community setup pharmacies are open all over the Pakistan. I can name many setup. So they are encouraging, and that is good sign of for the community pharmacists. So go for that community pharmacy, hospitals. So these two type of license experience is considered in Gulf countries. So you should have 2 years postgraduate experience. Like they will consider your experience after getting your degree. Like some people, like what we did in our time, we form 4 years and then we switch on the job and then come for the classes for 2 months, 3 months, switch on and switch off. So they don't consider this type of experience. They consider regular experience. There should be no gap in experience. 2 years consecutive experience for hospital and community. Thank you.
Okay, thank you, sir.
Thank you so much.
Ji Hajra.
Anything else? Yes, please.
Hajra, you can ask the question.
Arif, anybody else?
Hajra, do you have a question?
Hello, sir. Can you hear me?
Yeah, please go ahead.
Sir, my name is Hajra Yasin and I'm from Comsets University. Sir, I personally live in United Arab Emirates, and over the years, unfortunately, whenever I go to any community pharmacy, I always see Indian pharmacists. So is there any particular reason that we don't see mostly Pakistani pharmacists? Are they unable to register properly, or why is it? that we never majority we always see Indian pharmacists and we rarely see Pakistani pharmacists?
Yeah, that is very important questions, and these things are you can find anywhere, any pharmacy you will, but it is nothing like that. You can see many Pakistani pharmacists. There are hundreds of Pakistani pharmacists, but the thing is actually if we compare Indian population to our population, they are many times they are bigger country than us, and population is there more than our population. So it is not like that, but still, some organizations, some units, they encourage, because most of the organization, most of the community hospitals, they belongs to India. Like if I say there are, you can many hospitals, bigger pharmacy change. Maybe if you are there in UAE, you can see Esther Pharmacy, Life Pharmacy, Benzina Pharmacy. So this Esther and Benzina, this is the largest chain pharmacy in UAE. So it is owned by Indian. But even though they are Indian, but they still encourage Pakistani pharmacists. That is not like that they don't hire Pakistani pharmacists. They don't. But the thing is actually your point is valid. But still there are many pharmacists. They are working in very good organizations. They are getting good packages, and they are whatever they can do, they are doing for their communities. Since I'm here in 2000 from 2008, so we developed many communities like social group, WhatsApp group, Facebook groups, and since then we serve many pharmacists, and particularly for training, for orientation, licensing requirements, examination criteria, and even once they are here, we provided like some initial assessment, like support, anything we did, and still we are doing. If you have someone like a pharmacy senior, so there are they can help you a lot in job surfing, and still even there are many other countries pharmacy, Egyptian pharmacists, Syrian pharmacists. But your point is still there, that Indian population is bigger, so you should expect more Indian pharmacists in community setup and hospital setup.
Thank you so much, sir.
Thank you so much. Mr. Arifullah, any other one who wants to ask any question?
Sir, for the vote of thanks, I would like to call Dr. Amara. Dr. Amara, can you say a few words, please?
Assalamu alaikum, everyone. Thank you so much, Doctor Zia Ullah Samdani, for such an interesting session. And I'm the coordinator of Ambassador Program from NCBP, and this is official thanks to you. And we'll send you a thank you letter as well. That was such a great pleasure to meet you in this session. And thank you so much for all the participants and the session head. Thank you so much, Arifullah.
Thank you so much, sir. And to all the ambassadors of NCPP, I will surely share the slides with you in our group. And inshallah, it was a great session and a great deal of knowledge, and we have learned a lot from it. Thank you so much, Dr. Zia Ullah.
Thank you so much, Mr. Arifullah. So nice of you.
Allah Hafiz, sir, and Allah Hafiz to all the
Allah Hafiz.
participants.